Hello and welcome everyone. My name is Barbara McGahee-Brain, and I currently serve as the co-chair for the foundation of the ASC. And we cheerfully raise funds so we can distribute them as grant money in the areas of advocacy, education, and research. And we are very pleased today to be joined by our most recent advocacy grant awardee, Dr. Asteria Kimambo, and she has done wonderful things in the very recent past. And so I'm going to allow her to introduce herself and tell us about her project.
Okay. Thank you, Barbara, for your introduction. And my name is Asteria Kimambo. I'm a pathologist by profession from Muhimbili University of Health and Allied Science, in abbreviation called MUHAS, in Dar es Salaam, Tanzania. And currently I'm a PhD student in cancer research, and it's a 4-year PhD program. And as part of this program, PhD program, I was supposed to prepare a project plan. And one of my project plan was to become more focused on a project that I've been working for more than 5 years now, as my research interest is more focused on pathology, but more so on cytopathology. And we are trying to improve cancer care through screening, but also through using cytopathology as a diagnostic methods. And I've been working for all those years on how we can improve breast cancer. And the project was more focused on how we can use cytopathology to improve our biomarkers detections, that is ERPR and HER2 and KI67. So I've been working on how we can validate the use of our fine needle expression biopsy by using GeneXpert to detect these biomarkers so that we can improve the continuum of cancer care and bridging patient from the diagnosis to the treatment. So out of those patients on cytopathology, I decided to go more focused on other aspects of cytopathologies, trying to improve diagnostic facilities or diagnostic part in terms of cytopathology, by trying to improve how we see our patient and how we diagnose our patient using cytopathology, and more so on fine needle expression biopsies. So traditional, we used to see our patient in fine needle expression biopsy, where most patients, we do palpation fine needle expression biopsies. And this has resulted into patient coming back for second biopsy because of missing lesions, because we were doing under palpation. So I thought it's now a time that we can try to improve more so on cytopathologies and fine needle expression biopsies by adding different other aspects of cytopathologies, including rapid on-site evaluation of cytological material so that we can improve the adequacy, but also preliminary diagnosis, but also to try to incorporate ultrasound, which has been one of the key equipment which is missing in our clinics, where we usually miss the cases because there is no radiological correlation of the lesions to know exactly where we are putting our needles. So this is nutshell in this project that what I was trying to look for. So it's an implementation project where I wanted to implement the use of rapid on-site evaluation to make it usable and feasible, but also to incorporate ultrasound, training the pathologists on how to perform ultrasound, because traditional radiologists are the expertise who guide us on using ultrasound machine, especially to the lesions which are deep-seated or the lesions which we could not do palpations. So I wanted this to be as part of our field, to train pathologists, to train residents, to be able to perform ultrasound-guided fine needle aspiration biopsy, but also be able to perform rapid on-site evaluation using reagents which are very available at our own locality, and try to improve the cancer care, especially in terms of patients who are coming in our cytology clinics. So this is in a nutshell, a summary of this project. And this project is part of my PhD. So if I manage to finish this project, I'll be able to have a publication, because my PhD will be a PhD in publication. So I'll be able to publish several papers out of this implementation project of ultrasound-guided fine needle aspiration biopsy, but also rapid on-site evaluation for cytological material. So we will be more focused on breast, or however we have done breast before, and we've been published a pilot study of 50 cases so far in Pathology Archive, and we want to go more deeper and now training, because in this pilot project, this was my pilot project. So I was the PI who was performing all these FNA, but we wanted to be more so to other pathologists who are doing fine needle aspiration biopsy, but also resident to be involved and to be implemented in the routine care. So we publish more so in breast, but also we'll incorporate other lesions which need ultrasound guidance during sampling, especially thyroid, but also we'll try to go more further to lesions such as deep-seated lesion like liver. We'll also do some lesions such as salivary gland lesions, where we previously don't more focus on ultrasound. It's just by palpation, and then you put your needle, and sometimes you miss the lesion and the patient has to come back, or we may miss tumors and the patient go back home and then come after 2 years with lesions which are more advanced or advanced tumor, just because we have missed a lesion just by doing what we are doing currently. So it's just trying to improve care, like the continuum of cancer care as part of cytopathologies. And so because of that, this project need funding, and I thought it's important for me to secure several funding, because as we know, some of the PhD research projects, we were funded only for coursework. So I was supposed to secure additional fund to conduct this particular research. So because I've been mentored for several years by both, I had an opportunity to have a very strong mentorship, both locally with my mentors here in Tanzania, but also I've had a privilege to be mentored by expertise at UCSF, several cytopathologists at UCSF, and some of my mentors there currently in other hospitals such as Memorial Sloan Kettering. So I've been able to be mentored by a team of people who are very committed, and because of that, I was able to either have information of this type of grants when they come up, but also I've attended one of the meetings for ACC in 2018. And so I was more so involved. And so when the ACC Patient Advocate Grant came, one of my mentor just informed me, like, there is this opportunity and you can apply for it. We have a project, and this is a cytopathology project. I think they may be interested. It is coming from your area, which is a resource limited area. So, and I saw the opportunity and I talked to my mentor. We had a Zoom meeting. We discussed all these available opportunity funds. And the first one, fortnight, was ACC. So I jumped in, I started the application process. It was very tough by that time because I was also moving to UCSF for my coursework for the whole year. So it was a bit tough, but I managed to apply all this grant. And as we know, many grants, they need you to be focused. they need you to have mentors who can help you, who can lead you on how to write. What is the best way of writing? How do you write a grant so that you can make people support your research? So I've tried my best. I don't know how I scored, but I hope that I've scored to the point that I think the committee decided that I was good enough, or because of the mentorship team that I have, I can get this award and progress with the project and try to use cytopathology and try to implement or try to continue advocacy, especially in my area where we need both of these two techniques, both cytology and histology, to make a diagnosis, but also in other part of the cancer care, such as screening and prevention of cancer, because we still need to be able to go far away from where I am right now to try to pick cases where we can make a quick cytological diagnosis just by using rapid on-site evaluation and triage these patients to go and have cancer care. So I was happy to get this grant, to get this news, and it was last year. And by then I was at UCSF for my 1 year program of a coursework for my PhD. So despite that I was there, but I think it was an opportunity. And so currently I finished my coursework, which I was supposed to take them there. And currently I am in my country. I'm back and I'm ready to continue with my research project. So in terms of where I am right now, we are still, because I was applying for IRB while I was there, and there are differences on application for IRB, especially when you're a PhD student, in such that when you are a PhD student, your project has to be more comprehensive. It goes to a wider IRB meetings, and I can say the process of seeking for IRB, they're a bit more complex than normal researcher. So we have been in that process, and about a week ago, it has a chance to go to the meetings, and now we are finalizing, and perhaps most likely we'll have IRB around this month, and we can proceed with data collection. So using the funds, I was able to secure some of the equipments which were very important in this project. And one of the equipment was to purchase the portable ultrasound, because we wanted this training, because we originally didn't have a ultrasound machine, as I've said. So I purchased a portable ultrasound from Philips while I was there, and the fund was processed by UCSF, so we were able to secure this. So we have the equipment now, and we are trying to start making the training, especially to myself. I've been trained before. I've been trained 2 times locally, but I also had in-depth training while I was at UCSF in the cytology clinic with one of my long-time mentor. She's a professor. She's called Professor Britt Marie Young, and we had time with her. She was training me. So currently now we are trying to have more so on a local training. So we are, while waiting for IRB, we are still doing local training and try to purchase more additional equipment so that we can kick off the project. Thank you.
Well, thank you for sharing that. I apologize for my phone ringing in the middle of it, at the very end. But we are thrilled to hear about your progress and how far the project has already gone, which is thrilling. And we also would like to congratulate you. I know that June was a big a big month, you were invited to present grand rounds for UCSF, and that went off beautifully, I understand. And also you were awarded the Young Investigator Award at the ASCO meeting. You're a ASCO Global Oncology Young Investigator awardee this year. So we want to congratulate you on that as well. And we appreciate you taking your time today and encouraging others who might be interested in applying for one of these grants.
Yes. Yeah. Thank you, Barbara. And yeah, so with regard to additional funding, as I've said, we wanted to have a bigger picture of the whole project. And as you know, my PhD is for 4 years, so it needed additional funding. And so my mentorship team wanted me to go more deeper and try to apply for more additional awards. So ASCO came about. After the ACC, then ASCO came about, and I had to apply. And so I think I'm in a position to support the whole thing, to support the comprehensive part of the research project together with the ACC. And I think the ACC was the opening door for, I guess, for more additional funds. So I was happy to get the two, because I think the two will complement each other and we will be able to finish the task that we wanted, because as we know, the research needs a lot of support in terms of fundings. So I'm happy for that.
Fantastic. We are very happy to help people open doors. So thank you again for joining us today. And we look forward to seeing what happens next. Congratulations.
Thank you, Barbara.